If you've just had a dermal filler treatment using hyaluronic acids, then I'm going to explain to you how to look after yourself over the next few days, what to expect, and when to contact your clinic or your provider for further advice or support. Many of the hyaluronic acids act in a very similar way. Essentially, hyaluronic acids attract water, so you will get some temporary swelling after the treatment for the first 2 to 5 days. The best way to manage that is to use cold compresses, such as like a cold pack or a cold flannel, and just gently rest them on the area that's been treated. You don't need to push down or push firmly, just rest to reduce the swelling. There may be some temporary redness in the area that's treated. That usually settles after about 24, 48 hours. If redness develops after 48 hours, that's the sign of a possible infection, in which case you should contact your provider straight away for them to potentially prescribe you a course of antibiotics. Most people, I advise them not to touch their face that evening. So because when I've injected you, I've cleaned the skin and then I've cleaned afterwards. There's no need to wash it afterwards. You can wash your face in the next morning and you can apply makeup the next morning, so long as there's no signs of infection or inflammation around the injection points. The only place where you're going to have a risk of introduced infection from makeup is at the injection points. So make sure that those are clean. There's no need to massage dermal fillers. The only place I may suggest gentle massage between your finger and thumb is if the lips feel a little bit uneven. So after the first couple of days, you're wearing makeup, you're really carrying on with your day, and there's no real need for any other aftercare other than that. Again, during the first couple of days, I'd advise no swimming, sauna, steam baths, or strenuous activities such as squash or a very active gym session. Just be careful. After a couple of days, if you develop redness that wasn't there before, that could be signs of an infection, in which case you should contact your clinician for a reassessment and potentially a prescription of antibiotics. Your filler should integrate into your surrounding tissues in about 2 to 4 weeks. And so I generally review patients at about 4 weeks if they need any extra treatment to get optimal results. Times when you should contact your clinic. First of all, let's talk about an emergency. An emergency would be the development of little bubbles around the skin, around the injection points or around the area that was treated. That could mean that there's been a blockage of a blood vessel. It could be a tiny blood vessel, but it could still cause that. Then you need to attend your clinic so that they can dissolve the filler and clear that blood vessel. If you've left it a bit later than that, you might notice some scabbing developing in the area that was treated, or even beyond that area that was treated. Again, that's another sign of a vascular occlusion. And again, that would happen in the first 4 to 5 days following treatment. And finally, if there's any disturbance in your vision, please do contact the clinic or emergency services straight away. If you have any questions relating to your treatment, please contact the clinic straight away. And if you have any general questions about this video or any other content, please do post it in the comments below. Do give us a thumbs up and like this video, and please do subscribe to our channel for further updates on aftercare instructions following dermal filler or any other aesthetic treatment.